everyone, my name is Jennifer Jackson. I'm a registered nurse and I'm an assistant professor at the Faculty of Nursing at the University of Calgary. I wanted to make a quick video to talk about the difference between undergraduate education and graduate education. I'm going to use examples from nursing, and I wanted to make this video because I find that sometimes people don't understand the difference, and when you move from one to the next, it helps to have a clear concept of how the two differ. So I'm going to speak in very broad terms, but there are some central differences between undergraduate education and graduate education. So when you come back to do a master's in nursing or a PhD in nursing, or nurse practitioner, other advanced degrees, you are going to have to change your mindset a bit because we're going to ask different things of you than with undergrad education. So a big oversimplification, but kind of a nice shorthand, is in undergrad, you learn knowledge, and in grad school, you make knowledge. Now, there's distinctions between different parts there, but in undergraduate education for nurses, we are aiming to have you fit and safe to practice. So you're learning the introductory level information that every nurse must have to be safe to practice and to work safely and effectively with members of the public. So that's the primary objective, is learning that information, also going through the professionalization process, understand what it means to be a part of a profession and have a professional role, and the different obligations that are associated with that. When you come to graduate education, you've already had the professionalization and you've already built upon that foundational knowledge, and you have so much that you can draw from. So then what we ask you to do is reflect on those experiences, use the literature, and synthesize new understanding. So kind of understand the experiences you've had and then look to say, how could I lead in my practice in the future, whether it's as a clinical nurse specialist, nurse practitioner, nurse manager, any of those roles. So I know that sometimes students want to go into a master's right away after they've finished their bachelor degree. I highly recommend that you do not do this. The reasons being, people say, well, I'm already in school mode and this is just more school. And it's not. We're asking you to do different kinds of things. Another way that we can make a distinction is that if we think about Bloom's taxonomy, my personal favorite, there's other videos on my channel about Bloom's taxonomy, but in an undergraduate level of education, you are asked to describe, understand, and apply, largely. You do need to have some analysis, but you're generally the first 2, 3, 4 columns of Bloom's taxonomy is where you need to be. At a master's level, you need to be at the application and evaluation stage. So kind of columns 5, 6, depending on exactly which Bloom's taxonomy sheet you're looking at. And at a PhD level, you're creating new knowledge. You are at the top column. So it's not so much the idea that like, I'm in school mode, I know how to study. It's now we are asking you to do new skills and use different parts of your brain and do different things than previously. So sometimes students, when they come for a master's, they struggle because what they're giving us is what they gave at their undergraduate degree. And that was acceptable for the undergraduate degree, but we're asking you to do something different. So I recommend with your written work, you use Bloom's taxonomy to make sure you are at the application, analysis, evaluation level, and make sure that that is what you are presenting in your written work, because that is what is required of you. So if you give me a great discussion that is at the definition understanding level, it might be really well written, but it's not what we need. So it's important to keep those things separate in your mind about, now I'm being asked to use different skills. Another reason I say that the requirements I had when I went into graduate school and what I highly recommend for everyone is at least 5 years of experience, because we are going to ask you to reflect on your experiences to help shape your understanding. And if you don't have a lot of experience, it's harder to draw from those things. And the experience that you have in your first year is very different than the experience you have after you've had more time for professionalization and you're in your third, fourth, fifth, 10th year after your undergraduate degree. So when we encourage people to spend more time working either clinically or in another role before they come to grad school, it's not because you're not smart enough. You're smart and capable from day one, otherwise you wouldn't be in nursing school. It's because you need that base of experience to fully make the most of graduate education. So that is why we suggest that you leave some more time so you can build that experience up, because it helps you, and then you can make better contributions to your colleagues. And then you can bring that back to your clinical practice area. If you don't have the experience base there, it's going to be much harder. And everybody wants you to be successful. I want you to be successful. And so let's set you up for success from the beginning. So just a quick note to say, if you are in graduate level education, have a look at Bloom's taxonomy and know that you're asked to do higher level competencies than you have previously. And one of the best ways to make sure that you are doing that is to use words from those columns in Bloom's and make sure those words are part of your writing. There's loads of examples online. If you have a quick search for Bloom's taxonomy verbs, that can be the kind of word that you need to use to show you how do you evaluate, how do you critically analyze, appraise, contrast. That's what you need to be doing over define, identify, explain, and that type of thing. So, and to my fellow nursing PhDs, you are at a whole other level, and you're at the point where you are creating knowledge, and that is another set of competencies altogether. So a PhD, particularly in nursing, it's more like a job than it is like school, if you will. Your job is to say there's a gap in our understanding. Generally, that gap is one that's harming patients. How can I make new understanding and fill that gap? So this is why we need people to shift gears in how they think about things, is because you're asked to do different cognitive skills at different levels. So I hope that that's useful to frame your experience, whether it be in undergraduate or graduate school, and to think about how that can set you up and use that mindset to inform the work that you do.